I jumped out of my sleep as if an alarm clock woke me. A tiny scream echoed next to me as I reached for the lamp switch. 2:59 plastered brightly on the alarm clock as I realized I only had 2 hours of sleep from the last feeding. I had only given birth just a month ago, and due to the lack of sleep and pure exhaustion, I was miserable. I cried, I was fed up, so I started to do some research. I came across something called postpartum depression. It sounded so similar to what I was feeling. I wanted to know more, so I reached out to my healthcare provider and decided to go in and do in office testing. And then finally, that's where I was diagnosed with postpartum depression. With the help of my provider, all of my concerns and questions were answered. An individual treatment plan was created to help me start on my recovery for PPD. Hi, my name is Devere McLean. I am a mother of three, and today I will be talking about what postpartum depression is, how this disorder affects new mothers, and what the current treatments are available. What is postpartum depression? Per the Cleveland Clinic organization at myclevelandclinic.org/postpartum depression, also known as PPD, is a depression that happens after a new mother gives birth. There are also three postpartum mood disorders classified under postpartum. The first postpartum mood disorder is called postpartum blues. This disorder has none to mild symptoms, symptoms including sadness, anxiety, and frequent crying, and also is classified to be on the lower spectrum of the mood disorders. The next mood disorder, postpartum depression, typically has high to mild symptoms, and those symptoms include irritability, fatigue, anxiety, feeling guilty, and frequent crying. This is classified to be on the mild to high spectrum of the mood disorders. Lastly, postpartum psychosis has high to severe symptoms, including confusion, insomnia, paranoia, delusion, aggravation, and mania. This is also classified to be on the high to severe spectrum of the mood disorders. If you're feeling any of those symptoms from those types of mood disorders for postpartum, please reach out to your local provider as soon as possible. Now, during the postpartum period, um, how new mothers are affected per the Public Medical Central at www.pmc.ncbi.nlm.nih.gov. They state that scientists believe that the production of cortisol levels increase during the postpartum period. With the increase of cortisol levels, it independently affects new mothers psychologically and creates behavioral changes as well. With the decrease of estrogen, mental health disturbances can occur. These disturbances include long-lasting depressive symptoms, including sadness and loss of interest. And with also the decrease of proestrogen, physical changes can occur as well. These changes include cardiovascular disease, hypertension, and also poor sexual function. For treatments regarding postpartum mood disorders, per the Mayo Clinic organization at www.mayoclinic.org/postpartum-depression, they state for postpartum blues, no medication is required and usually goes away within 1 to 2 weeks with plenty of rest and self care. Also, recommending that you reach out to family and friends for the emotional support during the grueling time. With postpartum depression, this does require medication and also psychotherapy and other medications as well to treat the different types of symptoms. Lastly, with the postpartum psychosis, this does require immediate treatment. And this treatment can include medication and also electroconvulsive therapy. Recovery does depend on the individual and varies depending on the individual and their needs. So, to sum up everything, postpartum depression affects new mothers. There are three types of postpartum mood disorders: postpartum blues, postpartum depression, and postpartum psychosis. During the postpartum period, estrogen and proestrogen decreases and cortisol levels increases, which can independently cause mental and physical changes in that mother. Treatments vary depending on the symptoms and the individual type of postpartum mood disorder they're diagnosed with. If you're again suffering from any of those symptoms, please reach out to your local obstetrician or OBGYN, mental health care provider, and primary care provider. Those are all qualified healthcare providers that can provide individual treatment plans for postpartum depression. Thank you again so much for listening.